I'm Dr. Alan Stevens, and I have been diagnosed with dry macular degeneration about 10 months ago. And as I was getting treated, I read about red light therapy that they're using in Europe that seemed to be very effective in the case of dry macular degeneration. Fortunately, I've been involved with red light therapy for about 15 years through a product called the MedLight. It's a cold laser that shoots energy into the area that's being affected that you want to treat using this kind of technology. And basically, I decided after reading the literature and the testing that was going on in Europe that I would start to use the red light for my eye. The process is basically you use it for 4 minutes on each eye twice a day. So bottom line is that the beautiful thing about this technology that I've used for so many years, the one thing I knew about it, it can't damage anything. It may not effectively treat something, most of the time it does, but however, if it didn't, it wouldn't damage any tissue anywhere in the body that it's been used, that I've used it for, and friends of mine have used it over 15 years. So consequently, I was comfortable by putting it on my eye that it wouldn't damage it to a point where I only have one good eye. I don't see well out of my left eye. My right eye is the only eye I really see well out of. And consequently, I started to use it and started to realize that when you put it on the eye for 4 minutes, take it off, it's totally black. You can't see anything for about 20, 25 minutes. It has a process they call cascading. When you use it for the other technology, it's the same concept. So bottom line, when I put it on my eye for 4 minutes, I do both eyes 4 minutes each. I close my eyes for about 45 minutes or longer. And then when I open my eyes, it appears to be really nice and clear, which I definitely obviously see a difference, because normally I'll walk around where after I take drops from my eyes will be cloudy. My vision won't be as clear. But it appears every time when I do my first or second treatment and I wake up about an hour later, bottom line is everything's clear for a long time.
Is the MedLight made in the USA?
The MedLight is made, yes, in the USA by a company called Life Without Pain. And
is it FDA cleared device?
Well, the MedLight has been FDA cleared for all the years I was involved with the technology. It's called photobiomodulation. And what happens is the light emits energy at a certain wavelength, and that energy is absorbed by your tissues. And the penetration of this particular is about 4 inches. When we did it over the years, in different areas that I used it on. And so basically, when that energy is absorbed, it triggers the cells in the area you're treating to overcome some issues that they have based on if it's a damaged tissue, if you hurt yourself, or you have arthritis, or have any kind of other condition that you're treating. Basically, it gets to that area and effectively, at that cell level, improves the condition of that cell tissue in that area.
How do you use the MedLight for your eye? How do you use it?
So basically, all I do is I simply keep my eye open, and it has 2 buttons, an on and off button.
Does it have a timer on it?
And this product, ironically, and I believe it's in fate, that this is going to be very effective. When this technology was developed, it was developed with a 4-minute timer. Basically, we felt at the time that when you applied it to any area, you used it for 4 or 8 minutes, that was all the energy that was needed to be absorbed by the tissue to create a healing process on whatever was damaged. And ironically, when I looked at the studies in Europe and what they've been doing, it was a 4-minute treatment, per eye, twice a day. So basically all I do is I press the light, it goes on, put it on my eye like that, hold it for 4 minutes. It goes off automatically in 4 minutes. Hold it there for the 4 minutes, then switch to the other eye. And then when I finish both eyes, I virtually can't see anything. It's pretty, everything's dark. And I just keep my eyes closed. And I lay back and lay down for about an hour.
And it's called the MedLight 630 Pro?
It's called the MedLight 630 Pro. And I think you just simply have to go online and look it up.
Great.